Just got today's numbers that are coming in, and yesterday was high. Well, today is even higher. It was over 11,000 yesterday. Today, across the country, 16,055 new cases. Gauteng recording 11,553 of them. And when you look at the positivity rate, you realize why the Deputy Health Minister was so clear. 24.3% of all tests done are testing positive. That's a very high number. Let's find out what the COVID numbers are telling us. I'm joined by Ridhwaan Suliman, Senior Researcher at the Council for Scientific and Industrial Research. Dr. Suliman, thank you so much for chatting to us. So those latest numbers, again, a huge jump day on day. What are they telling you about the trends that we're going to see for the fourth wave?
Good evening, Sally. Indeed, the numbers are most concerning. Well, just breaching 16,000 new cases today, and that's nationally, and well over 11,000 just in the Gauteng province today. Unfortunately, what we are seeing is a very rapid rise in the number of confirmed cases. And while there is an argument that case numbers are not as important as other indicators such as hospitalizations and deaths, it does remain a leading indicator and possibly a glimpse into what we can expect into hospitalization numbers, which we can touch on. But also many people who are infected can possibly struggle with long COVID symptoms. So nationally, the 7-day average is just a touch under 7,000 new cases per day on average over the past week, or that's a case incidence of just over 12 per day per 100,000 people in the country. So breaching a threshold that indicates that South Africa is well into the fourth wave now. Importantly, to also consider is that test positivity rate. We just over 24% test positivity rate, and yesterday also over 20%. Certainly is confirming that the number of confirmed cases that we are seeing is not an artifact of increased testing. In fact, had we been able to test more, those numbers would actually be higher. So 24% test positivity rate indicates that just almost 1 in every 4 tests conducted is returning a positive result.
Yesterday I spoke to Professor Shabir Mahdi, and he suggested there might, and I say might because it's such early days, we might be seeing a de-link between caseload and hospitalizations. Also, Dr. Richard Friedland of Netcare issuing a statement today saying in the previous waves, with this number of daily cases, our hospitalizations would have been way higher than they are. Is it safe to say they're right, or is it perhaps a little early to look at what's going on with our hospitalizations and draw any real conclusions?
It probably is a bit early to make any firm conclusions, but we can look at what's happening in the province of Gauteng, which saw the earliest rise in the Omicron-driven wave. Over the previous week, the number of hospital admissions in Gauteng increased by just over 170% compared to the previous week, or a doubling time of about every 6 days, bearing in mind, though, that that is off a low base. However, that rate of increase is not as sharp as the rate of increase in cases, which are doubling about every 3 days. So possibly an early indication that there may be some decoupling between cases and then hospitalizations. I do think we do need to wait possibly a bit longer to make any firm conclusions. Remember the lag between cases and hospitalizations, as well as the reporting lag. So I think the next week may give a clearer indication of what's happening in Gauteng. There may be also more younger people being infected right now, and they are at a lower risk of hospitalization, so that too could be contributing to the slight decoupling or lower hospitalization rate that we are seeing right now.
But why would we be seeing more young adults and children in hospital? Is it just likely with the young adults that's where it broke out? We know that it was at the TUT University in Tshwane where we first saw some cases of Omicron, or is there something else at play?
I wouldn't be able to fully confirm, Sally. What we do know, as you indicated, is that there was this cluster outbreak in Tshwane, where a large a proportion of people in that Tshwane University of Technology tested positive. We saw that cluster outbreak spreading and then just continued to spread further at a rapid rate now across Gauteng. I can't confirm exactly what the reasons are for a larger proportion of the younger people being infected. Just don't have any specific data or indicators to speak to that at this stage.
You know, it was Professor Salim Abdul Karim, I think, who said that by the end of the week we'd be getting 10,000 cases a day. Well, we're now way past that. We're on 16,000 cases in one day. Predictions are that we're going to hit the peak in Gauteng in a couple of weeks, that the daily caseload is going to be really, really high. First of all, do you agree that we're going to hit the worst in about 2 weeks? And if you do agree, how do you work that out?
It's looking very likely, just looking at the rise that we're seeing right now, the rapid rise, as indicated, doubling about every 3 days in the province of Gauteng. It's looking very likely that the number of confirmed cases that we may actually see in this Omicron-driven wave will exceed what we have been seeing in the 3 previous waves, unfortunately. I think even if you take into account that test positivity rate incredibly high, we may see that based on that, there certainly are many more undetected cases. So I don't think we should be too surprised when we likely see the case numbers exceeding levels seen before. And just based on the current rate of increase in Gauteng as well, we may possibly reach a peak within the next 2 weeks. It's just such a rapid rise that we're seeing right now. It is still early days, even though the rise is rapid. It is still too early to make any accurate predictions, but it is quite concerning just at the moment.
So how do you know when a wave is going to peak? Is it just a numbers game? Because also with the third wave, we saw that we hit the peak and then we kind of just stayed there for quite a long time. So how do you work it out?
Yeah, there's a lot of unknowns, and we're still learning a lot about the Omicron variant as well. But one needs to take into account the proportion of the population that are susceptible. But recent research that's just been coming out indicates that reinfections are possible with the Omicron variant. One needs to take into account current levels of immunity, so both natural acquired immunity due to past infection and some recent indications of seroprevalence in the province of Gauteng indicating over 70% infection rate in the province, combined with the proportion of vaccinated individuals, indicated high levels of immunity. However, we are seeing reinfections being possible, happening as well. So that does affect the models and the predictions as well. There certainly basically are a lot of unknowns, Sally, and I think we're learning a lot every day. The current predictions are not looking great in terms of what case loading to expect. Hopefully, as we saw, the slight decoupling with hospitalizations, and I think we'll watch the hospitalization rate quite closely because that's probably the most important indicator to have an effect right now.
So we've been looking at the national trend, which today, 16,000 and counting new cases. Gauteng, over 11,500 cases. If we look at the other provinces, they're all ticking up. But of course, the Western Cape, just under 1,000, 957 cases, followed by KwaZulu-Natal, 897, and then the Northwest, 805, and the others are sort of from 3 to 600 odd. What trends can you see in terms of when the wave is going to peak in other provinces, or anything that's important to note about what's happening in the provinces around the uptick?
So Gauteng remains the epicenter and the province of most concern, driving the national figures. However, all of the other provinces are showing an increase in the number of confirmed cases, as well as hospital admissions too this past week. The other big provinces of Western Cape and KwaZulu-Natal are currently on a very sharp rise, both those provinces increasing by over 500% compared to a week ago. However, the absolute numbers are still off a low base, but that rate of increase is quite concerning in those provinces. They are a couple of weeks behind the trajectory of Gauteng, but pretty much following a very similar trajectory that we have been seeing in Gauteng. So those are to be watched quite closely. Then the neighboring provinces of Gauteng, including Northwest, Limpopo and Mpumalanga, all showing a very rapid rise too in the number of confirmed cases, increasing by between 400% to 500% over the past week. So they too are showing very similar trajectories to what we are seeing in Gauteng. So unfortunately, if Gauteng is anything to go by, we likely start seeing all of the other provinces following that trajectory, albeit with a slight lag. And then maybe just to touch on the hospital admissions in across the country, they have increased this past week compared to the previous week, but more so hospital admissions have increased across all 9 provinces, and it is still early days to read too much into the other provinces' data, but they certainly are showing an increase as well, albeit at a slightly slower rate than the increase in the number of confirmed cases.
Dr. Ridhwaan Suliman, thank you so much for your time this evening. He's a senior researcher at the Council for Scientific and Industrial Research. So we have a concerning picture emerging with COVID-19 hospital admissions, and as the doctor was telling us, there's been a 170% increase over the past week. Of course, there's some hope that maybe it won't be as bad as the previous waves, partly due to vaccination rates in the older people of our population, but those under 5 years and over 12 years and older, they are being hospitalized as well. Doctors say these age groups are possibly more susceptible to the variant.